Hi everyone, my name is Kamalakantha, and today I will be presenting on water insecurity as a barrier to women's health. Let me tell you a bit about myself. I'm a senior at Plano West Senior High School located in Plano, Texas, USA, and I'm passionate about grassroots level activism, specifically climate justice and clean water, as well as public health and music. Since the summer of my sophomore year, I have been a research assistant at Southern Methodist University for an NIH-funded Get Active study, where I've been researching the implications of physical activity interventions on public health, under the guidance of Dr. Austin Baldwin. I'm a fellow at the Grassroots Democrats HQ, where we work to elect Democrats up and down the ballot through phone banking, canvassing, and postcard writing, and we've successfully elected Reverend Raphael Warnock for the Georgia Senate runoffs in 2022 and Judge Janet Protasewicz for the Wisconsin Supreme Court in 2023. I've been trained in Indian classical music for 10 years, and I organized and performed in a charity concert this summer that funded water filtration devices for an underfunded government school in India. I'm also a coordinator at the Sunrise Movement Dallas Youth Hub, a climate justice nonprofit. So here's the agenda for today's presentation. First, I'll be providing an introduction to water availability and its accessibility, its health impacts, and I'll be concluding this presentation with solutions and an action plan. Clean water availability. 2.2 billion women lack access to clean drinking water. The United Nations recognized that access to clean water is a fundamental human right. They define clean water availability as access to clean, safe water for drinking, cooking, and sanitation. Worldwide, women spend 200 million hours each day collecting water for drinking. Not only does this prevent women from seeking an education and economic opportunities, but it is also dangerous, time-consuming, and physically demanding. And to put it into perspective of how physically demanding this is, some women in India walk an average of 16 kilometers, which roughly translates to 10 miles, just to collect water. And even with all this effort that they put into collecting the water, there is no guarantee that this water is safe to drink. The World Health Organization states that at least 2 billion individuals use drinking water contaminated with fecal matter. Drinking contaminated water is related to the transmission of diseases, which include cholera, typhoid fever, and hepatitis A and E, which are all fatal if not treated immediately. But you might be thinking, I'm not a woman, so how will this affect me? Well, with an increasingly interconnected world, these issues don't just threaten individuals or families. They undermine educational, health, and economic outcomes for entire communities. Gender inequities cause these solutions to disproportionately affect women, harming reproductive and menstrual health. For this reason, all women need a clean, functional, and safe space for them to manage their menstrual hygiene. So how can we combat this lack of access to clean water? So first off, reducing water insecurity will require alignment between non-governmental organizations, nonprofit organizations, private sector entities, and local government. These are scalable and efficient solutions which are absolutely necessary. Next, it is important to note that all these issues are global in nature, affecting primarily resource-dependent economies. Their impacts will likely be amplified by climate change. But there are many things we can do to combat this global health crisis? Number 1, we can invest in water infrastructure. Examples include construction of wells, utilization of water filtration devices, and even boiling water, which all increase access to clean water. Number 2, improving agricultural practices, such as water-efficient irrigation, organic farming, and crop rotation, which all conserve water. And number 3, promoting women's empowerment through vocational training and access to education. These enable financial independence, shift cultural norms, and improve sanitation practices at the level of individual families. In conclusion, water insecurity is a major global health issue that needs our immediate attention. Here are some ways we can contribute. Number 1, we can use and dispose harmful materials properly. Number 2, we can organize a beach, stream, or wetland cleanup. Number 3, we can raise awareness about water scarcity. Number 4, donate to Girl Now, Woman Later, and Wash United. And number 5, host a period product drive. These are my references. And I wanted to give a huge thank you to the Global Health Leaders Conference at Johns Hopkins University for this amazing opportunity to present live as a student speaker. I really appreciate it. And thank you all so much for listening.